This video will cover G6PD deficiency, an enzyme disorder of red blood cells. Let's start this one by looking at that railroad crossing sign. This represents X-linked inheritance of G6PD deficiency. You see our character here defending himself against that alien-like creature with a plasma gun. This represents the fact that patients with G6PD have protection against Plasmodium falciparum. Plasma sounds like Plasmodium, and the alien-like creature can clue you into falciparum because falciparum sounds like false. And some people, definitely not me, would say aliens are false. Maybe the alien here is trying to steal those nicotine pills. The medication bottle labeled with pH and nicotine on the ground and with only a few pills left should remind us that deficient G6PD leads to low NADPH levels. What about that polygonal gummy candy there on the ground? It represents low glutathione, which is also seen in those with G6PD. Glutathione is commonly abbreviated to GSH, and GSH sounds like gushers, doesn't it? If you were to abbreviate gushers. The bottle of ketchup here represents Heinz bodies, which are oxidized and precipitated hemoglobin. Self-explanatory. The label on the ketchup bottle that says super represents the supravital stain, which is used to visualize these Heinz bodies. And you see how the ketchup bottle is also spilling? That's a representation of hemolysis. In the middle of all this chaos, someone decided to take a bite of that burger. This represents bite cells, which are also commonly seen on peripheral blood smear. Maybe they only took one bite of the burger because there's something funky about it. I mean, look at that smell coming off of it. This is a reminder that sulfa drugs are oxidants that may cause hemolytic crises in these individuals. The burger is probably more well suited for that mosquito there. The mosquito represents malaria drugs such as primaquine, since malaria is known to be transmitted by mosquitoes. These drugs are also oxidants that may cause hemolytic crises. Oh wait, maybe it's those beans that are causing the awful smell. Remember that fava beans are another type of oxidant that can cause hemolytic crises. Okay, I'm not going to ignore the fact that someone in this image is clearly in possession of an illegal substance. It's that blue glass-like stuff. Let's just say that this is a representation of the fact that methylene blue is another oxidizing agent that can precipitate crises in these patients. If you don't know what I'm talking about, you need to get your priorities straight, click out of this video and go watch the show. Anyone like cars? If you do, you'll recognize that nitrous oxide bottle. If you don't, go watch a series of movies that's, let's just say, all about family. The nitrous oxide bottle represents nitrofurantoin, a common culprit in precipitating crises in these patients. Lastly, let's talk about that fluorescent lamp at the top of the image. It represents the fluorescent spot test, which aids in the diagnosis of the disease. Notice how the lamp is off. This will remind us that there will be no fluorescence in this test if the patient does in fact have G6PD deficiency. This is because they fail to produce NADPH, which is what causes the fluorescence. Please note that in days following a hemolytic crisis, a patient will have an increased number of reticulocytes, and these will contain a normal amount of NADPH. This could potentially lead to an erroneous result, so this test is not recommended in the days following a hemolytic crisis.